Amongst landscapes unchanged for centuries, a high-tech revolution is taking place.
We've been reviewing your data and see that after you started on the antibiotics and steroids, you're still a wee bit breathless in the evening.
Well, I did cut down on the steroids there.
Ian Cameron has chronic lung disease. Movement is difficult, let alone visiting a doctor. But his health is being monitored 24 hours a day.
This piece of kit, which works through Bluetooth technology, enables us to keep a real-time view on how things are going with patients' conditions in their own homes.
If I was breathless, I wouldn't be fit to go to the surgery anyway.
Is it uncomfortable? Is it a nuisance?
No, I didn't. Maybe if you have to go and see a doctor, well, it says you haven't to leave the house.
It's part of a pioneering pilot scheme called Digital Moray. In isolated rural communities, specialist healthcare can be many hours away.
What the doctors need to do is to get medical advice and help out to very remote rural areas.
So the idea of this software is to provide patients with personalised digital postcards.
Hi, I'm Alistair McKinley. I'm one of the gastroenterologists in Aberdeen.
I mean, there've been websites for years, haven't there? There's NHS Direct. I mean, what's different about what's going on here?
People are looking for a kind of chunky video format for the information, which gives them a more targeted, standardised type of information, rather than trying to search for something themselves on the internet.
The global healthcare market is worth trillions of pounds. After all, most people on Earth require some form of healthcare at some point, and digital technology is relatively underused. So, if the techniques being pioneered here take off, the growth potential is enormous. The project is in its early stages, but these patients can already see huge potential.
The process should be a lot easier than what they have just now. When you've got to get referred, then it waits on somebody's desk in the hospital administration, then the consultant has a free date, and then you get a letter saying you have to go. That would cut a lot of this down.
It's down to people using modern technology to speak to each other better.
Do you worry that it'll replace face-to-face contact?
I don't think so, because the initial contact still has to come face-to-face.
People here, once they've seen the GP, may have to travel through to Aberdeen. That can take up to 4 hours. It's very important.
Funding has come from many sources, including the local NHS Trust, the European Union and private businesses. And obstacles, such as patchy broadband, remain. But like its malt whisky and beautiful scenery, many believe Murray's digital healthcare could soon be world-renowned. Tim Muffett, BBC News.